Bonjour tout le monde. Good
Hello,
afternoon,
everyone.
everyone. Today, I am joined by my colleagues Bill Blair and Patty Haidu, and by Dr. New and Major General Fortin, who are in Ottawa this morning. Our government takes very seriously ways that we can act to prevent the spread of COVID-19. We're constantly looking at ways we can make improvements. This morning, the Cabinet COVID Committee met to look at what additional measures can be put in place and how we can enhance existing measures stringent in the world in terms of containing the spread of COVID-19. Comme vous le savez, le Canada continue de prendre des
The interpreter signals that the sound quality is not sufficient for interpretation.
de la COVID-19 au pays. Nous avons mis en œuvre des mesures frontalières parmi les plus rigoureuses au monde. Aujourd'hui, nous voulons renforcer un message très simple. Nous déconseillons vivement de voyager, sauf en cas de nécessité absolue. La Constitution ne nous permet pas d'empêcher les Canadiens de quitter le pays. Si vous devez voyager, sachez qu'à votre retour au Canada, vous devrez suivre les lignes directrices sévères et vous mettre en quarantaine pendant 14 jours. Si vous ne respectez pas ces exigences, des sanctions sévères s'imposeront. Permettez-moi de vous expliquer brièvement le processus. Tout d'abord, avant de prendre un vol de retour vers le Canada, les compagnies aériennes doivent s'assurer que les passagers à bord de leur avion ne présentent pas de symptômes de la COVID-19 et n'ont pas été exposés à une personne qui en est atteinte. Les voyageurs qui entrent au Canada par voie aérienne, terrestre ou maritime, à moins d'être exemptés, doivent également fournir des renseignements par l'entremise d'ArriveCan ou en composant un numéro sans frais pendant leur période de quarantaine ou d'isolement. Lorsque vous arriverez à la frontière, vous serez soumis à des mesures de contrôle et de sécurité extrêmement strictes. Nous avons accru la présence d'agents de l'Agence des services frontaliers du Canada dans les aéroports internationaux pour nous assurer que les voyageurs comprennent leurs obligations en matière de quarantaine et pour vérifier leur plan de quarantaine. Notre exigence de quarantaine est notre mesure la plus forte, parmi les plus fortes au monde, et il est efficace. Les rares fois où quelqu'un apporte la COVID-19 au Canada, lorsqu'il est en quarantaine, le virus s'y arrête. Il ne se propage pas dans la communauté. Peu importe le pays d'où vous arrivez ou l'endroit où vous rentrez au Canada, vous devez vous mettre en quarantaine pendant 14 jours, sauf exception explicite. Votre respect des exigences énoncées ci haut sera vérifié régulièrement, y compris par des visites en personne accrues lors des prochaines semaines. De plus, votre cas pourrait être renvoyé aux autorités de l'application au besoin. Soyons clairs, si vous ne respectez pas la quarantaine, vous pourrez faire face à un temps maximal de 6 mois et ou une amende maximale de 750 000 $. Plus important encore, vous mettez votre famille, vos amis et votre collectivité à risque. Certains Canadiens ont quitté le pays pour des raisons non essentielles, malgré les recommandations claires de santé publique de ne pas le faire. Ces Canadiens ont le droit de rentrer chez eux, mais à leur retour, ils ont la responsabilité et l'obligation légale de se mettre en quarantaine pendant 14 jours. Il suffit de quelques personnes qui interrompent la quarantaine pour propager le virus à la collectivité et ailleurs. Nous n'avons qu'à examiner le variant de la COVID identifié au Royaume-Uni, qui est maintenant au Canada, pour comprendre pourquoi. Nous encourageons vivement tous les Canadiens. Soyez responsables et surtout soyez raisonnables. Les règles ne nous protègent que si nous les suivons tous. Cette pandémie est en constante évolution. À ce titre, je veux également rappeler aux Canadiens que les restrictions changent rapidement et peuvent être imposées par des pays avec peu de préavis. Si vous choisissez de voyager, vous pourriez être contraint à rester à l'extérieur du Canada plus longtemps que prévu. Pour notre part, le gouvernement du Canada continuera de prendre toutes les mesures appropriées à nos frontières. Il y a maintenant plus de 180 agents de santé publique présents au point d'entrée à travers le pays. De plus, les mesures de restriction de voyage et les mesures frontalières que nous avons mises en place depuis mars sont efficaces. Par exemple, nous ne permettrons pas aux gens de rentrer au Canada pour faire des achats, rendre visite à des amis ou pour des visites touristiques. Le nombre de voyages a diminué de 90% dans les aéroports par rapport à 2019. En outre, seulement environ 2% de tous les cas de la COVID-19 signalés au Canada proviennent de voyages à l'extérieur du pays. Nous poursuivons notre collaboration avec nos partenaires de l'application de la loi provinciaux, territoriaux et locaux pour veiller à ce que les voyageurs respectent des règles de quarantaine. Nous évaluons, comme j'ai dit au début, en permanence les mesures actuelles pour nous assurer qu'elles fonctionnent et nous explorons les moyens de mettre en place des niveaux de protection supplémentaires. And to this effect, at the COVID Cabinet Committee meeting this morning and following conversations with the Prime Minister earlier this week and just a few minutes ago, I can announce that Canada will quickly implement the requirement for all arriving passengers to have a negative PCR COVID test 3 days before arriving in Canada. Lors de notre réunion du comité
During today's Cabinet COVID-19 meeting and following conversations with the Prime Minister throughout the week and a few moments ago, I announced that our government will quickly be implementing further measures. Passengers arriving in Canada will have to have a negative COVID-19 test results from a test performed within 3 days of their arrival to Canada. We continue to make decisions based on scientific evidence and data. That is what informs our border measures.
The microphone to my colleague, Bill Blair. Bill?
Thank you very much, Minister LeBlanc. Good afternoon, everyone, and thank you all for joining us here today. As you have already heard from my colleague, Minister LeBlanc, Canada is continuing to take strong action to limit the spread of COVID-19 in our country. And to that end, we have implemented some of the strongest border measures in the world. Today, we want to reinforce a very simple but important message. We strongly advise against travel unless it is absolutely necessary. The federal government, and in fact, no government in Canada, can prevent Canadians from traveling. But I want to be very clear. We strongly advise against all discretionary travel. And if you must travel, understand that upon your return to Canada, you must follow guidelines and quarantine for 14 days. It's not just the right thing to do. It's the law. And if you do not follow the requirements, it can result in significant consequences. Let me walk you through that process. First, before you board a flight home to Canada, the airlines are responsible for making sure that all passengers on board their aircraft are not exhibiting symptoms, nor have been exposed to anyone with COVID-19. Travelers who enter Canada by air, land, or marine modes, unless exempted, will also be required to submit information through ArriveCan or by calling the toll-free number during the quarantine or isolation period. When you arrive at the border, you'll be subject to strict screening and security measures. We have significantly increased the presence of CBSA officers at our international airports to ensure that travelers understand their quarantine obligations and to verify their traveler's quarantine plan. Our quarantine requirement is our strongest and most effective measure. It is among the strongest in the world. On the rare occasion that someone brings COVID-19 into Canada, when they are in quarantine, the virus stops there. It does not spread further into the community. And so no matter where you are coming from or where you enter Canada, you will be required to quarantine for 14 days. Your compliance with these requirements will be verified regularly. And if needed, your case can be referred to law enforcement in cases of non-compliance. And let me be very clear. If you violate quarantine, you can face up to 6 months in jail or up to $750,000 in fines. But far more importantly, you will put your family, your friends, and your community at risk. Now, we know that some Canadians have traveled out of the country for non-essential purposes, despite the clear public health guidance asking them not to do so. These Canadians, of course, have a right to return home, but when they come back, they have a responsibility, both legal and moral, to quarantine for 14 days. Unfortunately, it only takes a few people who break quarantine to spread the virus to the community and beyond. We only need to look at the COVID variant recently identified in the United Kingdom, which is now in Canada, to understand why. And that is why we are urging all Canadians to please be responsible, be sensible, and care about your fellow citizens. The rules only protect us if we all follow them. This is an ever-evolving pandemic. I'd like to remind Canadians that restrictions are changing quickly, and they may be imposed by Canada or other countries with little warning as circumstances require. And if you choose to travel, you may be forced to remain outside of Canada longer than you anticipated. For our part, the Government of Canada will take every appropriate measure that we can to protect our citizens at the border. There are now, for example, more than 180 public health officers present at points of entry across Canada. And the travel restrictions and border measures that we have put in place since March have been working. And for example, we do not allow people into Canada for non-essential purposes. We don't allow cross-border shopping, visiting with friends, sightseeing, or holidaying in our country. And as a consequence, travel volumes are down by over 90% at our airports compared to 2019. And through very careful contact tracing, we've determined that approximately 2% of all known COVID cases in Canada have originated from travel outside the country. 2% is very low, but it's still unacceptable. And that's why we must and will continue to work together with our provincial, territorial, and local law enforcement partners to ensure that travelers are following the quarantine rules. As I've already said, Canada has one of the strongest regimes anywhere in the world, but we are prepared and resolved to continue to add additional layers of protection to make it stronger. We will always continue to evaluate our current measures to make sure they're working, and we are exploring ways to build additional layers of protection. And I am therefore pleased to advise that CBSA is increasing its presence at our airports. Additional border service officers will be present at various positions in the traveler flow to reinforce compliance messaging. Beginning yesterday evening, additional teams of enhanced visibility officers were also deployed throughout the customs halls and baggage area and around the primary inspection lines to engage with travelers and to increase officer presence through conversation, highlighting the traveler's obligations and potential enforcement action that may be taken if the traveler is non-compliant with the all-important quarantine requirements. Those officers are also helping to potentially identify any additional travelers who may have signs or symptoms of COVID-19. We are investing in additional uniformed police presence, signage, follow-up calls, and support for police of jurisdiction in their enforcement efforts to uphold and maintain compliance with our quarantine measures. As you have already heard, discussions are underway to further increase enforcement on current measures about greater testing before travel and upon arrival. As Minister LeBlanc advised, the Minister of Transport will be adding a requirement for pre-COVID testing on all flights before entering Canada to further strengthen the robust measures we have already have in place at the border to our 14-day quarantine. I also wish to be very clear. This is not an alternative to quarantine. It's an additional layer of protection. And the measures that are contemplated by the Minister of Transport to require pre-boarding testing and verification of that testing are in addition to the quarantine measures. And so once in place, those measures will enhance our efforts to keep people safe and not offer an alternative to the all-important quarantine period. I'm advised that Minister Garneau, our Minister of Transport, will be engaging with the airline industry on this new requirement, and additional details will be made available by him shortly on how this requirement will be implemented. In addition, discussions are also underway regarding a testing pilot program at the Toronto Pearson International Airport. This pilot explores how a testing and monitoring program can be used to provide an additional layer of defense against the spread of COVID-19. This follows a testing pilot underway in Alberta. We look forward to sharing more details as these pilots are completed. And as well, work is well underway between the provinces, CBSA, and our public health officials about testing at additional locations. In our discussions with the province, we have heard some desire to use an entry testing regime to reduce the length of mandatory quarantine for travelers. I believe at the current time, we should only be considering testing as an additional measure of a layer of defense against the illness coming into the country. We will continue to strengthen compliance with this very effective tool of quarantine. And we will always continue to use science and evidence to inform any next steps. And we rely on our excellent officials, the Public Health Agency of Canada, for that advice. I look forward to continuing the work with all of our partners in making sure the measures we take at our borders are in accordance with the latest public health advice. And to be clear, we have one of the strongest regimes for the protection of Canadians at our borders of any country in the world. It has proven to be effective. We are asking people to follow the rules, but unfortunately, there will always be some people who choose to ignore them. Some people are going to choose to travel against our advice, and Canadians, I know, are concerned about those who are choosing to enter into discretionary travel. And that's why we believe it is necessary to enhance the measures that we have currently in place to ensure that Canadians returning from that travel are safe to do so. We know that we have a vaccine beginning to roll out across the country, but I want to be very clear. We still have a long path to go. We have a great deal of work to do, and I want to ensure and urge all Canadians continue to follow the advice of our public health officials. Avoid non-essential travel. Continue to use the health and safety measures of hand washing, mask wearing, and social distancing that have proven to be the effective measures. And for all of those who choose to travel and cross our borders, understand the importance of quarantine and that we will take the steps necessary to ensure your compliance. Thank you very much. And I'll now turn the microphone over to my friend and colleague, Mr. Haidu.
Well, thank you very much, Bill and my colleagues. I do have to say that it's very concerning to continue to see people across the country become infected with COVID-19. And as the number of people sick with this virus rises, so does the hospitalizations and the deaths all across our communities. And the suffering that many families are facing is significant and heartbreaking. Dr. New is going to provide an update shortly, but it is a sign that all Canadians have to work even harder to protect each other as we enter this increasingly dangerous time. As more people become infected, more people are also hospitalized, creating exhausting situations for healthcare workers across all settings who are working so hard to ensure quality care and save lives. The outbreaks in long-term care continue to devastate families and communities. Heartbreaking deaths over the last days in the Southbridge Roseview residence in Thunder Bay and in the Tender Care residence in Scarborough, just to name two, are tragic, especially given what we know now about how to protect residents of these care facilities. Our federal rapid response program will continue to work in partnership with provinces and territories to help in these and other outbreak settings. Over the past several days, we continue, as my colleagues have pointed out, to see Canadians choosing to ignore the federal travel advisories that warn against international travel. And our message is clear. Now is not the time to travel internationally. Any person that does choose to travel internationally is subject to a mandatory 14-day quarantine that will be enforced. The number of public health officials at the border and making phone calls to follow up with returning travels has increased since last March. And for Canadians who are choosing to ignore the federal travel advisories, we will be increasing quarantine verifications. In the days to come, we'll be adding a requirement for pre-boarding COVID testing for passengers on all flights entering Canada. And this new measure will further strengthen our robust efforts to prevent imported cases of COVID-19, but also allow us to further Canadian research on the most effective measures and combinations of quarantining and testing. And we'll continue to work with Quebec and Ontario on testing studies at the border. Everything that we will do at the border will be based on science to protect Canadians. We share the frustrations of Canadians who have been making sacrifices for months now when they see images of a minority of Canadians, their friends and their family and community members who are not following the rules. It is unfair to the millions of Canadians who've put their lives on hold to protect each other. Our border measures, including the 14-day mandatory quarantine, are some of the strongest in the world. In fact, as my colleagues have pointed out, they've prevented the importation and spread of COVID-19 so that provinces can remain focused on reducing community spread, protecting seniors, building their testing and tracing capacity, and most recently, vaccinating Canadians as quickly as possible. And we've been there for provinces and territories since the beginning. We've provided billions of dollars in safe restart funding to enhance testing, contact tracing, data management, and protection for long-term care. We've procured millions of PPE for healthcare workers all across the provinces and territories. We've provided millions of rapid tests for deployment in high-risk settings. We've sent in experts and the Red Cross and supported the clearing of backlogs of tests through our rapid response program. We've funded quarantine centers to better isolate people with no safe place to stay. We've helped to house homeless and other vulnerable populations to protect them from infection in crowded spaces. We've provided thousands of contact tracers to help reduce outbreaks, and we've ordered, paid for, and delivered approved vaccines way ahead of schedule to save lives and to stop the spread. All of this has been done to protect Canadians and their close ones. Our government will continue to be there for Canadians, but we cannot do the work alone. Canadians expect us to work together, and we need everyone to help. We need to pull together for the next bit of time to reduce the spread and save lives. We know the next few months are going to be hard, but we each have it in our power to help. Stay home, cancel your non-essential travels, and help out wherever you can. The simple actions that we do for each other today will protect someone's grandmother, someone's father, someone's sister. Let's continue to protect each other, Canada. And as we begin to see that light, let's make sure that we all get to safety together. Thank you.
Good. Thanks very much, Patty. And Dr. New, over to you.
Okay. Bonjour à toutes et à tous. I hope that you've all had a healthy, safe, and happy holiday long weekend. There have been 565,506 cases of COVID-19 reported in Canada, including 15,378 deaths. Nationally, there are over 72,271 active cases across the country, with over 6,280 cases being reported daily on average over the past week. The number of people experiencing severe illness continues to increase. Over the past 7 days, there were on average almost 3,650 individuals with COVID-19 being treated in Canadian hospitals, including over 720 in critical care and an average of over 136 deaths were reported each day. This week, we have seen a Moderna vaccine arrive in Canada's north for distribution to remote and Indigenous communities, and it is arriving in provinces as well in the coming days. Tens of thousands of people in our country have already been vaccinated with the Pfizer vaccine, and vaccines continue to be distributed. By September of next year, we are on track to be able to offer vaccination to everyone in Canada for whom vaccines are approved and recommended. As most Canadians are aware, several cases of the new COVID-19 variant identified in the United Kingdom have now been reported in Ontario, Alberta, British Columbia, and Quebec. All people identified in Canada with the variant were fortunately already in quarantine. Quarantine has proven to be a protective health measure that works. A monitoring program is currently in place with provinces, territories, and international partners to identify other COVID-19 variants as well, such as the one in South Africa. As the monitoring continues, it is expected other variants of concern will likely be found in Canada. To protect Canadians, the Government of Canada suspended all commercial and private passenger flights from the UK into Canada on December 20th and will continue to do so until January 6, 2021. All travelers entering Canada are subject to COVID-19 entry screening, regardless of their country of origin or mode of entry. In addition, all travelers who have recently been in the UK or South Africa are now also subject to secondary screening and enhanced public health measures, including increased scrutiny of quarantine plans and rigorous monitoring to ensure travelers are complying with quarantine measures. While early data suggests that the United Kingdom and South African variants may be more transmissible, to date there is no evidence that there is any impact on disease severity, antibody response, or vaccine effectiveness. Although most Canadians have heeded advice for non-essential travel, some Canadians are still traveling for non-essential reasons. This is deeply concerning. We must iterate that now is not the time to travel. We are asking Canadians to reassess any travel plans. Stay home to protect yourself, your family, and those most at risk of severe illness from COVID-19 in our communities. If you need to travel, you must now use the ArriveCan app before your arrival to Canada and for mandatory reporting during quarantine. You can learn more about this app at canada.ca/coronavirus. Mandatory quarantine is just one of the layers that our public health system is using to prevent the introduction and spread of COVID-19 in Canada. We've implemented some of the strongest border measures in the world, and we will continue to work together with our provincial and territorial partners to ensure that travelers are appropriately adhering to the mandatory quarantine upon entry to Canada. We will continue to evaluate the measures that are in place and evaluate new measures as the situation warrants. Looking forward to 2021, there's a lot to be hopeful about. Safe and effective vaccines are beginning to be administered. However, we must remember that until vaccines are more widely available to all Canadians, we must continue to follow our proven public health measures to control COVID-19. Canada remains on a trajectory for resurgence over the next 2 months. With infections rates remaining very high in many areas of the country, we must ring in the new year differently this year and resolve to carry on with effective public health practices throughout the coming months. Follow public health advice, plan safer holidays, stay home if you have any symptoms, and practice physical distancing, frequent hand washing, and wearing a mask as appropriate. Merci, thank you. Bonjour à toutes et à tous. J'espère que vous avez passé.
I hope you all had a healthy, safe, and happy holiday long weekend. There have been 565,506 cases of COVID-19 reported in Canada, including 15,378 deaths. Nationally, there are over 72,271 active cases across the country, with over 6,280 cases being reported daily on average over the past week. The number of people experiencing severe illness continues to increase. Over the past 7 days, there were, on average, almost 3,650 individuals with COVID-19 being treated in Canadian hospitals, including over 720 in critical care and an average of over 136 deaths reported each day. This week, We have seen the Moderna vaccine arrive in Canada's north for distribution to remote and Indigenous communities. It is arriving in provinces as well in the coming days.
Au Canada ont déjà reçu le vaccin de Pfizer.
Tens of thousands of people in our country have already had a shot of the Pfizer vaccine, and vaccines continue to be distributed. By September of next year, we are on track to be able to offer vaccination to everyone in Canada for whom vaccines are approved and recommended. As many Canadians are aware, several cases of the new COVID-19 variant identified in the United Kingdom have now been reported in Ontario, British Columbia, Alberta, and Quebec. All people identified in Canada with the variant were fortunately already in quarantine. Quarantine has proven to be a protective health measure that works. A monitoring program is currently in place with provinces, territories, and international partners to identify other COVID-19 variants as well, such as the one in South Africa. As the monitoring continues, it is expected that other variants of concern will likely be found in Canada.
Le gouvernement de Canada
To protect Canadians, the Government of Canada suspended all commercial and private passenger flights from the United Kingdom into Canada on December 20th.
et la suspension sera maintenue
This suspension of flights from the UK will continue through January 6th, 2021. All travelers entering Canada are subject to COVID-19 entry screening, regardless of their country of origin or mode of entry. In addition, all travelers who have recently been in the United Kingdom or South Africa are now also subject to secondary screening and enhanced public health measures. This includes increased scrutiny of quarantine plans and rigorous monitoring to ensure travelers are complying with quarantine measures. While early data suggests that the United Kingdom and South African variants may be more transmissible, to date, there is no evidence that there is any impact on disease severity, antibody response, or vaccine effectiveness. Although most Canadians have heeded advice for non-essential travel, some Canadians are still traveling for non-essential reasons. This is deeply concerning. We must reiterate that now is not the time to travel. We are asking Canadians to reassess their travel plans. Stay home to protect yourself, your family, and to protect those most at risk of severe illness in our communities. If you need to travel, you must now use the ArriveCan app before your arrival to Canada and for mandatory reporting during quarantine. You can learn more about the ArriveCan app at the website canada.ca/coronavirus. Mandatory quarantine is just one of the layers that our public health system is using to prevent the introduction and spread of COVID-19 in Canada. We've implemented some of the strongest border measures in the world. We will continue to work together with our provincial and territorial partners to ensure that travelers are appropriately adhering to the mandatory quarantine requirements upon entry to Canada. We will continue to evaluate the measures that are in place, and we will evaluate new measures as the situation warrants. Looking forward to 2021, there is a lot to be hopeful about. Safe and effective vaccines are beginning to be administered. However, we must remember that until vaccines are more widely available to all Canadians, we must continue to follow our proven public health measures to control COVID-19. Canada remains on a trajectory for an even stronger resurgence over the next few months. With infection rates remaining very high in many areas of the country, we must ring in the new year differently this year and resolve to carry on with effective public health practices throughout the coming months. Follow public health advice. Plan safer holidays. Stay home if you have any symptoms. Practice physical distancing, frequent hand washing, and wearing a face mask as appropriate. Thank you.
Merci beaucoup, Dr. New.
Thank you, Dr. New. And now, Major General Fortin. Thank you very much. Hello, everyone.
About vaccine distribution to date. The deliveries of the December allocations of vaccines, both Pfizer, BioNTech, and Moderna, are nearing completion, and we're poised for a sustained tempo in January and accelerate that tempo through early 2021. On the heels of last week's Health Canada Regulatory Authority announcement, we received 168,000 doses of Moderna vaccine. They are being delivered this week. Shipments to Canada's north began on Monday, and by tomorrow, we expect the remaining shipments of our December Moderna allocation to be delivered to designated vaccine delivery sites, including several northern, remote, and isolated communities. We're now in our third round of shipments from Pfizer-BioNTech. Last week, 212,000 doses were delivered to over 70 sites, and more than 12,000 will be delivered this week. This will bring the total to 424,150 vaccine doses delivered in Canada this month. Looking forward into January, we expect weekly shipments of Pfizer-BioNTech vaccines in the amounts of 124,000 for the week of January 4th and 208,000 per week for the following 3 weeks. For Moderna January's allocation, we're expecting a further 170,000 doses the week of January 11th. We're on track to have at least 1.2 million doses of Pfizer-BioNTech and Moderna delivered by end of January. So to adequately manage the unique cold chain requirements, we continue to acquire and deliver enabling equipment and supplies with deliveries planned in the upcoming weeks. This will enhance cold chain capacity and flexibility across the country and facilitate onward distribution to smaller locations. Online training for the workforce continues, and provinces and territories are identifying and preparing their teams to administer the vaccines. In collaboration with our federal, provincial, territorial, and Indigenous partners, we're building capacity to enhance the delivery of vaccines across the Canadian landscape and to ensure that as many Canadians as possible get immunized against COVID-19 and as quickly as possible. Permettez-moi de faire le point maintenant sur la distribution des vaccins contre la COVID-19.
I would now like to give an update on vaccine distribution. It is proceeding according to plan. Deliveries of the December allocations of COVID-19 vaccines, both Pfizer-BioNTech and Moderna, are nearing completion. We are poised for a sustained tempo in January and an accelerated tempo into February and March of 2021. On the heels of last week's Health Canada Regulatory Authority announcement, we received 168,700 doses of Moderna vaccine. They are being delivered this week. Shipments to Canada's north began on Monday, and by tomorrow, Thursday, we expect the remaining shipments of our December Moderna allocation to be delivered to designated vaccine delivery sites, many of which are located in northern, remote, and isolated communities. We are now in our third round of shipments from Pfizer-BioNTech. Last week, 212,000 doses were delivered to over 70 vaccine distribution sites. Over 12,000 will be distributed this week. This will bring the total to 424,000 vaccine doses delivered in Canada by the end of December. Looking forward to January, we expect weekly shipments of Pfizer-BioNTech vaccines in the amount of 124,800 for the week of January 4th and 208,000 per week for the following 3 weeks. As for Moderna's January allocation, we are expecting a further 170,000 doses the week of January 11th. We are thus on track to have at least 1.2 million doses of Pfizer-BioNTech and Moderna delivered by the end of January.
De la chaîne d'approvisionnement.
In order to adequately manage the unique cold chain requirements, We continue to acquire and deliver enabling equipment and supplies, with deliveries planned in the upcoming weeks. This will enhance cold chain capacity in provinces and territories, as well as enhancing flexibility across the country and facilitating onward distribution to smaller locations. Online training continues. Provinces and territories are identifying and preparing their teams to administer the vaccines. In collaboration with our federal, provincial, territorial, and Indigenous partners, we are building capacity to enhance the delivery of vaccines across the Canadian landscape and to ensure that as many Canadians as possible can be immunized against COVID-19 safely, effectively, and as quickly as possible. Also, I wish to extend my best wishes for the new year for 2021 to all Canadians. Thank you. Thank you, Major General. And now we will take questions.
Questions from media. One question and one follow-up, please. We'll start with 2 questions on the phone. Operator?
Thank you. La première question est de Boris.
First question, Boris Proulx, Le Devoir. Question. Hello. My question is for all of you, but maybe for Minister Blair or Dr. New. When will negative COVID tests become a requirement for entry to Canada? Also, when will there be rapid tests in Quebec's airports? Quebec has requested these actions be taken as soon as possible. Answer. Minister Leblanc. I will answer first, and then perhaps my colleagues can add to my answer. Today, we're announcing that a negative test result requirement will be announced in the next few days. Minister Garneau will implement this as soon as possible. But if I'm on a beach in the Caribbean this week, and then I have to scramble to find somewhere to get a test before I return, we have to look into that. Canadians want there to be very stringent, strong border measures for those arriving at our borders. We are working in partnership with Quebec to discuss and work on testing in airports. We are working together very amicably with the government of Quebec. We expect to have more information in the coming days. In the meantime, as Minister Blair has stated, travelers who arrive at Montreal's Trudeau Airport this week and in the upcoming weeks will face additional screening, stronger screening. Quarantine is the most effective way to protect against COVID-19 and limit spread in our communities. Those who arrive to Canada will have more compliance verification. We will be doing more monitoring of quarantine. For instance, visits to the residences of those who are quarantining or increased phone calls. As of now, we are working on implementing a requirement for a negative COVID test results for those arriving to Canada. There will be more information tomorrow. Follow-up. My question is about vaccines, about the Pfizer vaccine. 2 doses, as you know, are necessary. Is Pfizer requiring that provinces store half of the doses for those who have already received a first dose? More specifically, a question for Major General Fortin. Should provinces be worried about future incoming shipments of the Pfizer vaccine? Should provinces start storing second doses for those who have already been vaccinated? Dominique Leblanc speaking. Dr. New, go ahead, and then we'll hear from Major General Fortin. Dr. New.
being. We've, of course, committed to an equitable distribution of vaccines. So this means that we'll aim to not create and, in fact, actively work to reduce disparities that are related to COVID-19, including disparities in the social conditions that are linked to increased risk of illness and death related to COVID-19. Critically, this involves ensuring that those who experience greater burdens or those who are at risk of experiencing greater burdens from COVID-19 are at the forefront of our minds when making recommendations. In addition, equity fundamentally commits us to respecting the equal moral status and human rights of all individuals and to distribute vaccines without stigma, without bias or discrimination. And in fact, our ethical framework emphasizes the legal obligations that exist to take preventative steps to stop the spread of COVID-19 and treat people without discrimination, and to ensure that vaccine distribution and prioritization decisions comply with existing human rights protections. The third guiding principle in our framework is fairness. Among other things, this commits us to ensuring that every individual within equally prioritized groups has an equal opportunity to be vaccinated, so that some groups don't experience avoidable barriers to accessing the vaccine when they have been prioritized. Fairness also requires that we ensure that jurisdictional ambiguity, like if there were ambiguity regarding jurisdictional responsibility between federal, provincial, or municipal governments regarding the vaccination of certain populations in Ontario, like First Nations populations, doesn't interfere with vaccine distribution. So we're making sure that people are getting the vaccine when they need it. So here we invoke Jordan's principle, which is used in Canada to ensure that First Nations children living on and off reserve have equitable access to all government-funded public services. And fairness also requires inclusive, consistent, and culturally safe and appropriate processes of decision-making, implementation of our plan, as well as communications about the plan and the rationale for the decisions we're making. A fourth guiding principle is, no surprise, is transparency. This is something that's crucial for public trust. This guiding principle requires that the plans for COVID-19 vaccine prioritization and distribution, as well as the underlying principles and rationale for those plans, are clear, that they're understandable, and that they're communicated publicly. And finally, we've committed to ensuring that our recommendations and decisions regarding vaccine distribution are seen as legitimate by committing to grounding these recommendations and decisions in the best available data, the principles that are outlined in our ethical framework, as well as from input from affected parties, including those that are historically underrepresented in decision-making. So if the work of our task force is not seen as legitimate, public confidence and trust in our work may be diminished. So we felt this is quite important. And so using these principles to guide our work together will help to promote the final cross-cutting guiding principle of our work, which is public trust, which we hold quite dear to the process of our recommendations and decision-making. And so by making this ethical framework public at this point, it's still December of 2020, we're putting the principle of transparency into action by explaining the key values and considerations that will guide vaccine distribution decisions. We also hope that this ethical framework will inform the work of others involved in the vaccine distribution rollout, say at regional or local levels, to ensure that all vaccine distribution decisions follow a consistent ethical approach. So I'll stop there. Thank you very much, and I'll hand it back to Dr. Heyer and Dr. Yaffe.
Thank you very much, Dr. Smith. I'm just, people may look at this and it's very, very principled. It's really well thought through. But some people may have some difficulty understanding how does that translate down to an operational perspective. So as an example, the prioritization subgroup, which is a group of 16 physicians and bioethicists who are trying to help to provide advice and recommendation to the task force about prioritization of populations or sequencing of populations to be vaccinated, have started to have discussions around healthcare workers, for example, because we know that decision has been made that there are 4 key groups that are going to be populations that are vaccinated during the period of time to approximately March, and those will be those seniors who live in congregate care settings where care is provided for seniors, and all of those who work in those settings. So it's the residents, it's the patients, it's the staff, and anybody who's an essential caregiver. So that's population number 1. Population number 2 is a very broad category of healthcare workers. Population number 3 is First Nation, Métis, and Inuit adults in Ontario. And population number 4 is those who are receiving home care on a chronic basis. And so all of those each have their own sub-prioritization or sub-populations within. And so we've done some early work to talk through developing a matrix which is applied to, for example, healthcare workers in hospitals, where we look at three things, which is the exposure risk, the transmission risk, and then the criticality. So how critical is that service to ensuring that there's effective healthcare resources. And so that will be applied and worked through to help to sequence populations within the healthcare field over the first phase of immunization. For example, paramedics, where would they fit in to that first phase, which is the phase that will occur over the first three months? And similarly, where would family doctors and primary care physicians fit in? Not to tell you where those will be, but those are topics, because we're still figuring those things out, but that's an example of how the prioritized risk guidance will be utilized to really define and provide a view into how vaccination will occur. Now, having said that, there's also significant consideration of logistics. So which vaccines are available? How can those vaccines be provided? What is the number of those vaccines? And so those are the kinds of things that are also key components of thinking through how do we sequence, how do we deliver, and how do we provide the vaccination to those who are in the populations to be vaccinated. I think at that point, Dr. Yaffe, I don't know if you wanted to add anything at this point or if we'll open for questions.
No, let's just open for questions.
Perfect. So we'll take questions. Unless, Dr. Smith, you want to add anything else after that?
No, I think that's great. Thank you.
Thank you.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
And a reminder to press *1 if you do have a question. And your first question will be from Christina Tenelia at CP24.
Hi, doctor. Thank you so much for taking my question today. Dr. Smith, you talked about priority for the vaccine going to the most vulnerable groups. Dr. Heyer, you noted a list and a matrix, but you also noted in the framework for distribution that the priority should be given to those who experience or are likely to experience greater burdens due to COVID-19 in society. The framework document you have shared notes the Ontario Human Rights Commission's policy. And it also notes groups that include women and children facing domestic violence or abuse, people with disabilities, the LGBTQ community, workers in precarious employment, prisoners. But those groups, people in those groups, are nowhere listed formally in the first two phases of the vaccine rollout. So where do they fit in? And how does that fall into the equitable distribution of the vaccine?
Max, do you want to start with that, Dr. Smith?
No, I'd be happy to. So I think you're pointing to something really important that we wanted to highlight in the ethical framework itself, which is to say that we want to protect those populations who are most at risk, but not just due to biological factors, but also due to social factors, to geographical factors, and occupational factors. And so we wanted to build in the thinking that we can think about those that are at risk for other reasons other than just being high risk biologically. So I think, and as well as human rights concerns and other considerations that you've raised, these are all the considerations that need to be weighed. It's not terribly straightforward identifying the exact populations that those point to, but absolutely those are the sorts of considerations that the ethical framework requires us to think through. And I think, Dr. Heyer can speak to this, but these are the sorts of things that will continue to inform those priority groups in phase 2.
Yeah, absolutely. Thanks, Dr. Smith. So those are all considerations that we are now also talking about at the prioritization group and will be raised at the task force as those key examples of thinking about how does that population and that group and the vulnerabilities associated with them and other risks that are associated, as well as potential inequities, where do those all fit into the prioritization? And we are hoping to have additional information about a longer term view beyond the first 4 groups that I talked about. And we're working closely together with the task force and bring the sub-prioritization group to bring those to the task force in the next while.
Follow-up?
Thank you very much. My next question is about what has been called Immunization Task Force. Previously, Health Minister Christine Elliott noted that vaccination or proof of vaccination may be required per se for travel, to go to a movie theater. I'm wondering, Dr. Smith, is that ethical, number one? And number two, does your group have any evidence that there are any industries, the travel industry, the entertainment industry, that plan to enforce this in any way?
So Dr. Smith, if you take the first part, I'll take the second part.
Yeah, no, happy to. So I mean, the idea of having an immunity passport or some sort of certification of vaccination certainly raises a lot of different ethical considerations. One of those considerations, of course, is, you know, we want to make sure that we're identifying those that have been vaccinated for their first dose so that we can get them back for their second dose. It helps us to understand surveillance in terms of how much of the population actually has been vaccinated, but the extent to which that information would be used to limit services or other things, I think is an important question where you need to think about potential stigma and inequities that may emerge from that. And Dr. Heyer, you can speak to whether this question itself is within the remit of the task force work itself.
Yeah, I can't speak to whether it will be within the task force right now. I'm not aware of specific reach out. I certainly haven't seen any, but I can't speak for the whole task force. So it's not been a topic that's come to our prioritization group. But having said that, exactly as Dr. Smith said, we do need to have a good understanding of the vaccine uptake, understanding who's had it, and have a perspective from a health point of view to understand the degree of immunity that may arise from the vaccine. So all of those things are important things for the moment to think through how effective and what are the next months into years as far as the vaccine goes.
Next question.
From Kelly Botello at CHCH News. Please go ahead.
Good afternoon. Retired General Rick Hillier said paramedics will have to wait until the spring for vaccines. Why aren't paramedics one of the first groups in line for vaccines like other essential healthcare workers?
So a few minutes ago, I did comment that the paramedics are within the healthcare field and will be within the first phase, which is extending to about March. So that's the plan. I can't speak specifically to what General Hillier was saying, but from my perspective, what we also know is that in the first phase, we're going for the most vulnerable folks first, and those are the long-term care home staff, residents, retirement home staff and residents, recognizing assisted living where people are of greater vulnerability and all of the staff that are working there. And then as we move through the first phase, there will be multiple populations that will be vaccinated at the same time. So paramedics may come at a different point with other folks that are in the healthcare field. All of that work will happen to some extent by logistics, but paramedics are recognized as an area of healthcare and are recognized as an area that will be vaccinated within the first grouping.
Follow-up.
Niagara Region has 35 paramedics self-isolating, which obviously puts a big strain on their service. Are situations like these taken into consideration when it comes to vaccine distribution?
So we take a variety of things into consideration. What we look for, and talked about that a little bit earlier, which is exposure to COVID for the particular person who's working in that situation, or the patient or the resident, and then the potential for transmission, and then the criticality. So all of those factors are important factors. So it really is both from a provincial perspective, then within a population, so the population of paramedics, and then within the region. And then after you look at the particular region, then within that paramedic group within the region, there may be some prioritization based upon age or based upon other factors that may put them at greater risk. So it's all of those pieces or considerations that are applied through the consideration of who would be vaccinated. And I don't know, Dr. Smith, if you want to add anything to that, or did I capture it effectively?
No, I think that's exactly right, Dr. Heyer. It's risk of exposure is a critically important dimension here when we're thinking about prioritization, and certainly paramedics, other emergency first response have a degree of exposure, high risk of exposure. We need to think about criticality in the patient populations they serve. And then, as Dr. Heyer mentioned, wanting to make sure that we're targeting those groups in regions that are particularly burdened by COVID-19 so that we're getting right to those that need it most as quickly as possible.
Next question.
From Sarah Levitt, CBC. Please go ahead.
Hi, thank you very much. Wondering, when we look at distribution, of course, the vulnerable population is a huge consideration in the prioritization. How much is the decision based around areas that are perhaps vulnerable? So, for example, like Brampton, which is currently a hotspot.
So I'll jump in. It's Dirk. So thank you for that question. Another example of something that is a significant consideration where there is a greater burden of illness, so where there are more cases such as Brampton, Toronto, York, Windsor, Essex, all of those are areas, and there are others, of course, but those are those ones that have been particularly affected right now, Brampton being part of Peel. So yes, that is a consideration, and we will use that as one of the many factors of deciding within it goes back to that what I was talking about as far as a regional approach. So there's a population, so the population of long-term care residents, staff, and retirement home residents and staff, and vulnerable seniors, residents and staff. So take that as the vulnerable seniors who are living in congregate care where care is provided for seniors. That would be the population. Then thinking within that population, one of the key factors, or one of the factors, doesn't mean it's the key, would be the area where, and understanding the extent of the infection within an area. So it's taking that population and then another factor within the population that's regionally specific.
If I could,
Yes,
I
please,
could add
Dr.
to
Yaffe.
that, yeah, thank you. The first distribution of the Pfizer vaccine has been through a select number of hospitals due to the requirement to keep the vaccine at an extremely low temperature. However, the vast amount of immunization will be planned and coordinated through the local public health units. And the local public health units have a very good sense of what's going on in their community. They'll be working collaboratively, obviously, with other parts of the healthcare system, hospitals, physicians, community health centers, paramedics, and so on. And so they will, within the framework set by the province for prioritization, they will be directing vaccine to the most risky within that priority group. So that is built into it from a local delivery point of view.
Follow up?
I'm just going to add one quick thing to that. That's an excellent addition, Dr. Yaffe, and frankly, it fits exactly into what we've been thinking about in the approach to prioritization, which is the public health units have the regional knowledge, they have the expertise, they are vaccine experts, they have been doing this for years, and they in fact will apply the prioritization at the regional level based upon, as Dr. Yaffe said, from the provincial framework, and because they know not only do they know their own region, they'll work together with the hospitals, they'll work together with Ontario Health, they'll work together with the other community leaders to figure out how to best provide that within the local areas. Thanks, Dr. Yaffe.
Follow up?
Yeah, so we're always hearing when it comes to vaccine priority, the most vulnerable first, that being the most important thing in this prioritization. Now, I don't know, maybe this is a question for Dr. Yaffe, but we haven't actually seen the most vulnerable vaccinated yet in Ontario, long-term care residents. And I know that it's been said before that it's the complications around moving the Pfizer vaccine because of it needing that cold conditions. And yet Quebec, for example, got the vaccine at the same time as us, and they got it delivered directly to the long-term care homes. So I know it's coming, but what's the reasoning for it taking until the Moderna vaccine to get the vaccines to the long-term care residents?
We have started with the people who work in long-term care and essential caregivers, and the not only because of the Pfizer vaccine logistics around its storage and transportation, but also our experience has been that outbreaks in long-term care tend to be introduced by workers, obviously not for their own fault, but because they are people who live in the community. And if they're in a community with a lot of transmission, they can then bring it into the facility. So one of the most important ways of reaching long-term care homes is through the workers to help prevent transmission into the home. We are starting now that Moderna's coming today, I believe. We are going to start offering vaccination with Moderna to residents of long-term care and high-risk retirement homes this week. So we're doing it as soon as we can with Moderna, at the same time continuing to reach the workers and the essential caregivers.
Next question.
From Darren Boland at Global News Radio 640 Toronto.
Good afternoon, everyone. Thank you very much for taking my call. These questions are on behalf of my colleagues at Global News Toronto. My first question is a two-parter. How much oversight is the Ministry of Long-Term Care providing to homes experiencing outbreaks, and what is being done to ensure proper staffing levels at homes with extreme outbreaks are being maintained?
Well, obviously, none of us are with the Ministry of Long-Term Care here, but I am on the Long-Term Care IMS table. The Ministry of Long-Term Care is very closely involved in monitoring all the outbreaks and working very closely with Ontario Health and bringing in management orders and bringing in hospitals to help, for example, with tender care, which I have been involved with, and bringing in other facilities, as well as just having set up a specialized care center through the Grace Hospital for offloading patients from long-term care as needed. So they're very closely working on that situation. It's obviously very high priority, very high vulnerable population.
Follow-up.
Thank you for that answer, Dr. Yaffe. And my follow-up would be, what is the breaking point into which the province would suggest military intervention? Has this been recommended to decision makers?
I can't really answer what the breaking point is. Certainly it's a consideration, as is, bring in potentially Canadian Red Cross, which has offered its services, and depending on what the needs are, has been taken up. So these are all considerations. I can't tell you the exact breaking point.
Next question.
From Alex Boyd, Toronto Sun. Please go ahead.
Hi, guys. Thanks for taking questions. I just have a question about what transparency means in practice. You've spoken about the link between communication and trust from the public, but right now Ontario is only reporting the number of doses administered, I believe, on a weekly basis. Will we see more transparency for the public in terms of who is getting these shots? I know some American jurisdictions are even breaking it down by, geography, age, race, and ethnic background. Is that something we could see, something we should see?
So I'll respond to that. And at this particular point, we are increasing the frequency of vaccine reporting, I believe, over the next number of days. The specifics as to the individual subtypes, I honestly don't have the knowledge right now exactly what will be occurring with that. So unfortunately, I don't have a specific answer for you, but the numbers, we have been, and I believe we are going to move towards reporting every day.
Follow-up.
Sure, and yeah, just to stay on the transparency piece, I know a lot of this is being decided as we go, given the uncertainty around approvals and transportation. But as you guys start to make decisions about who will be prioritized, how is this going to be communicated to the public? How far in advance will they know specifically if they're in line? How will they know when it's their turn?
Now, those are great questions, and thank you for asking those. So that is work that we are actively engaged with at the prioritization subgroup, having those conversations, thinking about which populations will be sequenced in what particular phase and over what time frame. And we're hoping to sort through those over the next number of weeks and have that information publicly released, is the understanding that I think we are working towards, so that people have an understanding where they will be, what group they would be. It won't be down to the individual level of when Dr. Smith is going to get his vaccine or when Dr. Heyer will get his vaccine or Dr. Yaffe, but it will be the populations and the areas that you would fit in. And then within those populations, as I talked about in the healthcare workers, will need to be, again, sub-prioritization, thinking through the greater risk that one person in that population may have with the other. So there is a fair bit of logistics that will be required within. As the number of vaccines increase, the availability will increase, the speed will move forward, and the populations will be provided vaccines, offered vaccines in a more rapid process. We know that Pfizer's been approved by Canada. We know Moderna's been approved by Canada. Both of those happen fairly quickly after each other, and others are being looked at, as is my understanding.
Last question.
Will be from Mike Walker, CTV Toronto. Please go ahead. Please unmute your line, Mike.
There we go. Thank you for taking my question. Just following up on a question my colleagues had asked earlier about paramedics. I know you mentioned that the expectation is that they will receive the vaccine in March. What needs to happen in order for that to happen? And is it possible that they may have to wait until the second phase?
So the anticipation is that they are part of the first phase.
Follow up, and this is the last question.
And just two parts to that. What needs to happen so that the vaccine will be available for them by March? And secondly, what about other first responders like firefighters who are also expressing some concerns? When can they anticipate to be a priority?
Now, these are all questions that we're working through with the prioritization group. Will be defined by a number of different things based upon the risk levels that will be identified. We have, in Ontario, identified 4 groups, and those 4 groups have been publicly released, and those are the ones that we are working together, all of us, across the vaccine distribution and the vaccine administration areas, public health units, hospitals, many different professionals, to provide the vaccine in the most efficient and most equitable way over the first number of months, and healthcare workers were one of those groups that were included. Others will be worked on through discussions, and hopefully over the next coming weeks there will be further clarification of all of the different groups based upon the discussions that we have flowing from potential risk, flowing through the ethical framework that's applied and utilized and informs all of the discussions. Those discussions will then be brought to the task force for consideration, and as those decisions are made, I anticipate they'll be released publicly.
Thanks, everyone.
Thank you, Dr. Smith. Dr. Yaffe?
Thank you.
Thank you.